And here now with more on the debate, Congressman Tom Price is chairman of the Republican Study Committee, ranking member of the Health Subcommittee, and a member of the Financial Services Committee. Congressman, good to see you this morning. Welcome.
Great to be with you, Carl. Thank you so much.
So now we've got the debate morphing even again. First, it was sort of about expanding coverage. Then it was about trying to rein these evil insurers in line. And now it's about saving costs over the long-term course of the deficit. Is this going to make any difference?
Well, I don't think so, because I think what the American people have heard and what they want to know is what role is the government going to have in all of this. And their concern is that the government's going to have a very personal role, very specific role in the medical decisions that they make between themselves, their families, and their physicians. And that's the real concern. Who's going to decide? There are ways to reform our current system by keeping what's good in the system, fixing what's bad, but not putting the government in between of patients and doctors.
When you say fixing what's bad, what does that entail?
Well, we've got to make certain that everybody has availability and access to health coverage, health insurance. The number that's bandied about is about 47 million folks that don't have some sort of insurance during the course of a year. About a fourth of those are, in fact, individuals that are unable to find the financial means to be able to purchase insurance. There are easy ways to be able to fix that through tax credits, tax deductions, refundable credits, and the like. We need to make it so insurance is portable, so that it goes with folks when they change their job or they lose their job. It's a real concern of the American people, and it's something that we can fix relatively easily without having the government take over the entire system.
Is it possible, though, to get a large group of people who are currently without coverage and not raise the bill?
Sure, absolutely. There are savings within the system, especially the practice of defensive medicine. None of the bills on the Democrat side of the aisle do anything to address the liability issue. That amount of money spent each year.
Many millions onto access to health care and not have the price tag go up?
Without a doubt. We have the bill, H.R. 3400, and it provides for making certain that everybody has the financial wherewithal to be able to purchase health coverage. It makes it so that that coverage is portable, makes it so that decisions are made between patients and their families and doctors, reforms the liability system, and doesn't raise taxes one penny. You don't have to have a $1.3 trillion price tag, which is what the President and the Democrats' bill does in the House, in order to reform the system.
I mean, you know, waste, fraud, and abuse, or being clever about when to take aspirin sounds awfully tough as a way to say that you're going to pay for millions of people who currently don't have access to health care. It just, with all due respect, it sounds absolutely implausible.
Well, in fact, the amount of defensive medicine practice in the United States is probably in the range of about $300 billion. That's a significant amount of money. You can cover a lot of people with that amount of money. Secondly, the duplicative nature of health care right now can be significantly improved through health IT and information technology that can be used to make certain that you don't have the redundant tests and the duplicative tests. And as a matter of fact, there's money that's still on the table, folks that are eligible for programs right now for whom there's money allocated, Medicare, Medicaid, S-CHIP. About a quarter of those individuals who don't have health insurance already have money allocated for them. And that's an easy way to get those folks insured. So you don't have to turn the system up on its head and have the government in charge of everything, when in fact, as you know, if you think health care is expensive now, just wait until it's free is the old line.
Mr. Price, when you say that you want patient-centered health care reform, what do you think specifically about the co-op proposal being put forward? Is there anything that you've changed to that proposal?
Well, we haven't seen any specific language in the co-op proposal, so from my perspective right now, it looks like it's just a wolf in sheep's clothing. I don't sense that there anybody who is running to the co-op plan who in fact wasn't for or isn't for a single-payer or some sort of government-run program. It's who's making decisions that we ought to be talking about here, not who's what we're going to call it. And if we've got the government making medical decisions, which is what the current House bill would have, then that's the wrong place for those decisions to be. And that's why you see this kind of anger and angst across the land from Americans who are very, very concerned about the government getting involved in those personal medical decisions.
So politically, talk about the politics surrounding it. Do you expect Democrats to swing for the fences on their own terms and dare you guys to try to bring it down, or do you still think there's any hope for some kind of bipartisan measure?
Well, if you go by the numbers, there's no way for Republicans to bring it down. In fact, the problem that the president's having is in his own party. They have 60 votes in the United States Senate. They've got at least a 70-plus seat majority in the United States House of Representatives. So they could pass whatever they wanted to pass in either chamber. The fact of the matter is that what folks are hearing back home in this August recess period is that the American people are not interested in the bill that they've put forward, in the proposal that they've put forward to have the government be intimately involved in medical decisions. And so either they change that, either they make it so that it is indeed a patient-centered system and we fix what's wrong in our system but retain what's right, or they swing for the fences. If they swing for the fences, then I think 2010, in terms of the election cycle, gets very, very interesting.
Yeah, that's what cynics would say the GOP is hoping for.
Absolutely not. That's why we've put a solution on the table. We've asked to come to the White House, talk to the president about it. He's rebuffed us at every occasion. We've asked to be involved in the process.
You have three of the most powerful senators in the Senate on a finance committee group working on how can you say you're being rebuffed by the president?
Well, because they're two different chambers. The Senate may be acting
you're talking strictly about
manner.
Congress people.
In the House of Representatives, we've been shut out of the process at every turn. But what we have is a solution that we've put on the table that would provide to make certain that all Americans have the financial wherewithal to be able to purchase insurance, that allows the portability. They can take it with them if they change their job or lose their job. Makes it so that medical decisions remain with patients and families and doctors, and fixes the liability system, and does all of that without increasing taxes one penny.
The way you sell it, Congressman, is that it's so simple. It can be done with a snap of the finger when it's an issue that clearly it's taken decades to get to this point, and it doesn't look like we're going anywhere quickly.
Absolutely. But oftentimes, the simplest solutions are indeed the best. What this requires, which isn't simple, is leadership. And the leadership right now will not allow for the individuals. There's a majority in the House of Representatives that would, in fact, come together for a solution if it had the right leadership. And that's what needs to happen right now. It's like in everything else, like in business, the decisions that you see and discuss every single day. The successful companies are the ones that have quality, high-quality leadership that's inclusive in terms of the decisions that are made, not exclusive.
Most people want really good health care, and they don't want to pay for it. And I think you've got a plan there that allegedly provides some of that.
Congressman, appreciate your time. We'll see if anything happens with the president
so much
on vacation this week. Congressman Price.
I appreciate it, Carl.